um, to the CDOH Board of Directors, Administration, the CDOH Radiology and Center for Women staff are here, other clinical staff of Cebu Doctors University Hospital, friends from the media, and of course our special guests from Siemens who are here with us today. A warm welcome to all of you, and welcome to our launching of two new technologically advanced equipments which are now here in Cebu Doctors University Hospital. You know, as medical imaging technology advances, as we become more precise, more accessible, this has radiology has become an essential foundation of modern medicine practice. It can help, it aids in the diagnosis, in the treatment, and prognosis of cases. Although these technological developments have engendered some anxiety amongst radiologists, especially artificial intelligence. Some radiologists are worried that we lose our jobs because of AI. But I firmly believe that these technology advancements will only complement and augment our practice. It will not displace the radiologist. It will help us improve our diagnosis and aid in the treatment of these patients. So today we are launching two superior or technologically advanced equipments. First is the Siemens Revelation, Mammomat Revelation, which features tomography, breast tomography 3D, and this will result in better diagnosis of those small lesions in the breast. Now, if you find it at the early stage, it's curative. And then next will be the MRI or Magnetom Sola fit, which is a wide bore MRI machine, 70 centimeters, which helps ease the claustrophobia of the patients. And also it features AI or artificial intelligence technology as well as biomatrix technology. So both of these machines will result in superior images, better quality images, which leads to, of course, a better diagnosis and helps improve patient comfort. No? Because you see, when you do the MRI, it will take 30 minutes to 1 hour, depending on the procedure, but now it's better tolerated by the patient because of the wide bore and the faster scan times, and the less repetition needed because of the AI technology. And for the mammogram, it's also faster, less discomfort to the breast. So both of these equipments are now available in Cebu Doctors University Hospital, and both of these are the first in the region. So it's only found here within the region, only in Cebu Doctors University Hospital. So again, welcome everyone. I hope you can, for the media, you can ask questions to our specialists, Dr. Christine and Dr. Mary Jo, if you have any questions about the mammogram and the MRI. Okay, so thank you again for coming and welcome.
Everyone, first of all, I am very happy to see all of you here today. Our friends from the media, our members of the board of directors, our consultants, training officers, and some residents. It's been a very difficult 2 years, because of the pandemic. But there is no doubt that what kept us through these 2 years is, of course, our faith in ourselves, our faith in God, and of course, the faith in our institution. 5 years ago, I promised you when I was installed that I will not stop and continue to build centers, provide innovations, not only for the people in Cebu, but the rest of the Visayas as well. So since 5 years ago, we have opened approximately 15 centers, opened a new hospital, and also developed other equipments that are not available in the region. So as we approach our 50th year anniversary, yes, CebuDoc University Hospital is already 50 years this August. We embrace it with a new normal. And we opened it with a bang. No? 2 weeks ago, we opened 3 new centers in Mactan, our new medical arts building, our new hemodialysis center, which is started by 5 chairs, we're now 30 chairs. And lastly, our rehab center. And here, in CebuDoc, this is our biggest investment at 150 million, 125 million for the mammogram. For the mammogram is 25 million and 125 for the MRI. Okay, so this just proves that we have kept our word. We are offering the new technology in our region and in Cebu. No? The mammogram I've experienced firsthand. I have a lot of patients because I'm an ophthalmologist. I have a lot of elderly patients. Most of my patients are women. And they said, congratulations doc, your new mammogram is very fast, less dependent na sa technician, and also painless. No? So I told them, that's good, I'm happy that you are happy. For the MRI, I just learned today that the richest man in the Philippines had a recent shoulder injury. No? And the first hospital he went to in Manila, he was advised an MRI of the shoulder, which would last 45 minutes. So he refused because he couldn't stay inside that structure for 45 minutes. No? So he went to another hospital which had a newly installed MRI, no? Same as this, no? the Sola. And he was told that it would only last 20 minutes. So he immediately went to this hospital, did MRI, and was very happy the next day. So again, friends, thank you for being here, and please spread the word, no, that these two technology, they're available here at CDOH. Please inform your friends, for consultants, inform your patients, educate our residents, and thank you very much. God bless us all.
The radiology department is one of the pillars of the CebuDoc University Hospital. It plays a major role in the diagnosis and even the treatment of patients in the hospital. We are one of the most complete radiology departments in the country. In what we have in CebuDoc University Hospital, we have all the diagnostic modalities and even the treatment necessary for patient care. For diagnostic side, in the radiology department of CebuDoc University Hospital, we have the general X-ray, fluoroscopy, bone densitometry, ultrasound, MRI. We have 2 units of the CT scan. For nuclear medicine, we have the gamma camera, and then the recently introduced PET-CT, PET scan. For the interventional side or treatment side, we have the radiation therapy unit with the linear accelerator and IMRT. And then we also have interventional radiology.
So true to our core value of innovation, we have this new machine now that's available for our patients' use and for our physicians' use that promises to improve the patient satisfaction with the MR. Specifically, what we have now is crisper, more clear images. We can do examinations faster, so we can image more areas of the body without compromising patient comfort. So now we are able to give them a better patient experience. So it's easier for the physicians to convince their patients to have an MRI done. It's faster, it's more comfortable. We have the largest bore machine, meaning we don't have as much claustrophobia as the other conventional MRI machines. But in terms of preventive, what we can do is we can diagnose these diseases very early, when it's easier for the physicians or their team of physicians to be able to treat them and give them alternate options and what to do from there on. And added to that, of course, we pride ourselves as radiologists that we like to have a personal interaction with the referring physicians, so we know exactly what it is they want from us. When we work together, we come up with an image, we come up with diagnoses or differential diagnoses that can help them in managing their patients.
Cebu doctors just recently acquired top-of-the-line Siemens Mammomat Revelation. It is a 3D imaging known as digital breast tomosynthesis. Digital breast tomosynthesis is a screening and diagnostic tool as compared with the digital mammogram, which only takes one projection. This takes series of multiple projection, then reconstructed into small dots about 1 millimeter thick, which eliminates the overlapping structures. With tomosynthesis, because of that elimination, you will see the breast pathology clearly and increased cancer detection. Breast cancer is the most common cancer in women, in fact overlapping lung cancer the past 3 years. We are following the American Cancer Society guidelines. Women 40 years old and above are encouraged to do the mammogram annually. Early detection means early stage of the disease, the treatment outcome, and prognosis will become good.
So our aim for wellness is prevention of disease, prevention of cancer. So with the latest mammogram that we acquired, we will be able to treat the cancer or mass at the early stage, so it will be curative. With the new MRI, the imaging is faster also, and with the improved quality of images, the diagnosis will be better. So we'll be able to detect the disease earlier with the new machine.